What is chronic fatigue syndrome? Chronic fatigue syndrome, also known as myalgic encephalomyelitis, is a debilitating and complex illness. It is characterized by persistent and overwhelming fatigue that is not relieved by rest. This fatigue can significantly impact daily activities, making even simple tasks seem impossible. CFS and ME is not simply feeling tired, it's a serious medical condition that affects many body systems. The exact cause of CFS and ME is still unknown, making diagnosis and treatment challenging. There is no single test to confirm CFS and ME, and it is often diagnosed based on a combination of symptoms and ruling out other conditions. This can be a frustrating and lengthy process for individuals seeking answers and support. Researchers are actively investigating potential causes, including viral infections, immune system dysfunction, and genetic predisposition.
Recognizing the symptoms. The hallmark symptom of CFS-ME is profound fatigue that persists for at least 6 months and is not alleviated by rest. However, fatigue is just one piece of the puzzle. Other common symptoms include muscle and joint pain, cognitive difficulties, often referred to as brain fog, sleep disturbances, and headaches. These symptoms can fluctuate in severity, with good days and bad days being common. Some individuals with CFS-ME also experience orthostatic intolerance, which is a worsening of symptoms upon standing or sitting upright. This can manifest as dizziness, lightheadedness, and increased heart rate. Gastrointestinal issues, such as irritable bowel syndrome, are also reported by some individuals with CFS-ME. The wide range of symptoms and their fluctuating nature can make CFS-ME a difficult condition to diagnose and manage.
The challenge of diagnosis. Diagnosing CFS-ME can be a long and frustrating journey. There is no single test to confirm the diagnosis, and many of the symptoms overlap with other conditions. Doctors rely on a combination of factors, including a detailed medical history, physical examination, and ruling out other potential causes of fatigue. The diagnostic criteria for CFS-ME are complex and have evolved over time. The most widely used criteria are the 1994 CDC definition and the 2011 International Consensus Criteria. Both emphasize the presence of debilitating fatigue, post-exertional malaise, a worsening of symptoms after physical or mental exertion, unrefreshing sleep, and cognitive difficulties. However, diagnosis remains a challenge due to the subjective nature of some symptoms and the lack of objective biomarkers.
Life with CFS-ME, impact and adaptation. The impact of CFS-ME on daily life can be profound. The unpredictable nature of symptoms and the often debilitating fatigue can make it difficult to maintain employment, education, social activities, and relationships. Simple tasks like showering, dressing, and preparing meals can become monumental challenges. Many individuals with CFS-ME experience social isolation and a sense of loss due to their limitations. The invisible nature of the illness can also lead to misunderstandings from family, friends, and even healthcare professionals. It's important to remember that CFS-ME is a real and serious medical condition, and individuals living with it deserve understanding and support.
Treatment and management strategies. Although there is no cure for CFS-ME, there are treatments and management strategies that can help individuals cope with their symptoms and improve their quality of life. Treatment is individualized and often involves a multidisciplinary approach, addressing both the physical and psychological aspects of the illness. Some common treatment approaches include pacing, which involves carefully managing activity levels to avoid overexertion and minimize symptom flares; cognitive behavioral therapy, or CBT, that can help individuals develop coping mechanisms for managing fatigue, pain, and other symptoms; and medications. While there is no specific medication for CFS-ME, certain medications can be used to manage symptoms such as pain, sleep disturbances, and mood disorders.
Living with CFS-ME, a message of hope. Living with CFS-ME can be incredibly challenging, but it's essential to remember that there is hope. While there is currently no cure, ongoing research is shedding light on the underlying mechanisms of the illness, paving the way for more effective treatments. Support groups and online communities can provide a sense of connection and understanding for individuals with CFS-ME and their loved ones. By sharing experiences, resources, and coping strategies, individuals can navigate the challenges of the illness together. Remember, you are not alone in this journey.